Let's bring in Dr. Abdou Sebushishe, the Senior Global Health Advisor with the International Medical Corps based in Goma in the Eastern DRC. Thank you so much for joining us, Doctor. Actually, you know, the fact that we've got a virus outbreak and fighting at the same time has been one of the core problems with this disease, hasn't it? Because we didn't catch it spreading early enough.
Absolutely. This Ebola virus has happened in situation where we have conflict across different hotspots of this outbreak, which hampered certain interventions that help to contain epidemics of Ebola, such as contact tracing, where we need to follow the different contact of positive cases and follow them through 21 days to ensure that if they develop symptoms, they are properly isolated to avoid further spread. And this can only happen if access to different hotspot area where contacts and suspect cases can be currently.
Is there any suggestion from the groups fighting here that they would allow that or even think about it or allow any access?
International Medical Corps is a humanitarian organization which is politically neutral. We work directly with the affected population to ensure the access to different affected area, and that has helped us to at least provide some level of response, including isolating quickly those who are suspected, but also the confirmed case, and provide them the dignified treatment that is needed. That engagement with the community is key to ensure that access to different locations is provided. I'm quite sure that other organizations that work around access are also doing their best to ensure that all the areas, all the hotspots where outbreak is being spread are accessible by the responders.
I know you're not a political group, but it has become a political issue, hasn't it? Because there are many people on the ground who are refusing to believe in this virus and are, resisting help from the authorities.
And the key issue currently with the outbreak is the misinformation and rumors and stigma on isolation and Ebola as a whole that is hampering the community trust toward the health system, but also the responders. And that it's something that needs to be corrected quickly with different activities, engagement with media to spread the right information to the community, accurate information. And I think CNN has been doing this quite a lot this time. So thank you on behalf of the team that is on the ground. We need more engagement with the community, spreading the right information to them and ensure that they adopt the preventive measures and accept when necessary to be provided care in dedicated facilities. That help a lot when community understand and are engaged, from the planning to the implementation of different interventions related to the outbreak. That community engagement help to contain the outbreak quickly, because this is a community transmission, and the input or the contribution and the engagement of the whole community is needed to make sure this is contained quickly beyond before it crosses other areas.
Are you clear on exactly which areas you need to contain? Because it is spreading rapidly, isn't it? There are even people outside the country, people taking it outside the country, but are you clear on exactly what area you need to work in and focus your efforts?
There are a lot of efforts to ensure that all contacts are traced, contact of confirmed cases, so that they can be followed up and ensure that whenever they develop symptoms, they are isolated properly. Currently, the outbreak is spreading faster than the response capacity, and that is concerning. We ensure that a lot of preparedness activities are being implemented even in unaffected area, the zones that are considered high risk, to ensure that we put in place preparedness measures that can help to quickly detect the positive cases in new hotspot or emerging hotspot. But this is work in progress. So far, the outbreak is quite progressing a little faster than the current response capacity.
Okay, Dr. Abdou Sebushishe, really appreciate you taking time out from your very important work. Thank you for joining us.